Hi everyone, today's video is about breastfeeding and I'm going to do my best to keep it brief and succinct. This is just a quick collection of tips from a pediatric standpoint. I would encourage you to use other sources of information such as lactation consultants, including the one in the hospital. I would encourage you to deliver to a hospital where lactation help is available. You may also consider picking your pediatric practice for one that does have lactation available. It has been such a blessing in the practice I'm currently in that we have wonderful lactation consultants, and it's a source of education for both the pediatricians and the parents, so that's just a wonderful resource. I also would like you to look into your insurance benefits. Most of them will now pay for a breast pump, so if you're allowed to order it before the baby's born, that's just sort of something nice to have available for after the baby arrives. One less detail for you to worry about when you're busy with the newborn. So think about all of those things as you go into the delivery, even before it happens, and realize that it's very normal and encouraging if you see changes in your breast prior to delivery. So you should have noticed throughout the pregnancy that the breast tissue size is increasing, and you'll notice more vasculature, more prominent veins on the breast, and that's also a good sign that your body is preparing to make milk for this baby. So now let's jump forward to the delivery room itself. Everyone has this idealized notion of a smooth, easy, great delivery. I pray that is the case that you have as well. And then right after delivery, the baby will naturally just latch onto the breast. And that is wonderful and precious when it works. But I just want to let you know, it does not mean that your chances of breastfeeding aren't still excellent just because you don't have that initial idyllic moment in the delivery room. So many things can happen in the delivery room that are beyond your control. And it doesn't mean if it just takes a few minutes for the baby to get some extra attention early on, or maybe you may need some extra attention, that it won't still work out eventually. Now, if things are going well and the baby's doing fine and you're doing fine after the delivery, absolutely, as soon as you can, attempt to get the baby latched. So most of what I talk about in the clinic when I'm seeing newborns for recheck weight visits and for their initial first office visit is all about the latch. This is where it all happens. So I just want to encourage you to really focus on getting a good latch, both because it will help preserve your nipples for them not to be so sore, and it'll help the baby get more milk. So this is how I want for you to think about it. I want for you to think the baby's mouth needs to be just as wide open as possible, because you need to try to get as much of the breast tissue into the baby's mouth as possible. You want for the entire color portion of the nipple, the areola, to be completely in the baby's mouth. This is for several reasons. You have extreme sensitivity on the very tip of the nipple. If that baby loses the good latch and gets those gums, which are what do all the damage to your breast tissue, down to the very tip of the nipple, ow, that hurts, and it damages your nipple, and it can cause tissue trauma and bleeding and scabs, and that can sabotage your successful breastfeeding attempts. So make sure the entire portion's in, and those gums are massaging the milk ducts further up, because the baby will get more milk if it massages those milk ducts. That's what we need to happen. Plus, the very tip of your nipple, as it strikes on the back of their palate in their mouth, it actually triggers an automatic reflexive suckling on the part of the baby. So latch is important. Wait till the baby's mouth is wide open, and then you do some rapid arm movement. You just get that baby right on the nipple with as much in there as you can. That is critical. Now let's say you attempt latch and suddenly realize it's excruciatingly painful, or the baby's crooked and doesn't have a good latch. Don't just pull the baby off, because that's going to cause further trauma. You want to break suction, then pull the baby off and retry. Now, early on, it is very normal to experience some uncomfortable feelings. You could use the word pain, as the nipple is elongated in the baby's mouth. That can be a little bit uncomfortable to start with. But with good latching and with time and healing and figuring out what you're doing, that goes away completely. And breastfeeding is absolutely not a painful process at all. Just for the first little bit when you're trying to adjust and the nipples are getting toughened up, a little bit of discomfort is normal. If it's significant, you definitely need to meet with a lactation consultant and make sure you ask for that at your weight check visit at the pediatrician's office. And they'll have a lot of good suggestions. Some of them are, make sure that you are alternating which side you start on. Now, you should know these days there's a big emphasis on making sure the baby's getting the hind milk. The hind milk is the end of the breastfeeding session. It's the milk at the back of the feeding that is higher in fat and protein. So it satisfies the baby more, it has more calories, it's just good for everybody. So we don't want the baby just snacking like 5 minutes and 5 minutes. I would rather you completely empty the first side of the breast breast at that feeding and then do the other breast at the next feeding, then just snack and just get what we call the fore milk, which is higher in carbohydrates and can cause more gas and greener stools in the breastfed infant. Now, I have jumped ahead to a mature breast milk days. Remember, it is normal that you will only have colostrum in the first few days, especially with your very first baby. It can take 3, 4, even 5 days for the mature breast milk to come in. You'll start to know that it comes in because your breast will feel much larger, even engorged. Now, that's another thing we can talk about. When your breasts are engorged, maybe day of life 2 to 3, it can make it hard for the baby to latch on because it's like them trying to latch onto a brick wall. It's just so hard and distended. So you may have to hand express some breast milk to soften up the nipple so the baby can latch better, or even pump for just a few minutes to get some milk off. Say that it's all precious and valuable like liquid gold, but if you can do that to soften the nipples so the baby can latch, that would be just fine. So back to nipple soreness. You may need to leave your nipples open to air. There's a good reason not to have too much company in the newborn period. You know, we don't want a lot of company anyway because the baby's susceptible to infections and we don't want any fever in the newborn period. But one of the reasons you don't need a lot of company is if you're having sore nipples, you need to let them open to air so they won't get a yeast infection, so they'll heal faster. You can also hand express a bit of breast milk and massage that in. And if you have open sores or bleeding areas or scabs, you can use a little antibiotic ointment and gently pat that off before the baby's next breastfeeding session. So other things you can try for nipple soreness. Remember, we were talking about those gums that can do the damage, but also do the work of breastfeeding to massage out the milk from the milk ducts. Well, if you can imagine when the baby's latched in different positions on the breast, they're gonna do that massaging on different locations. So a lot of moms who've had C-sections, we recommend the football hold, which is when the baby's beside you and you have control of its head with the hand on the same side the baby's on. And that's a great one because you can hold your breast with the C hold and then adjust your breast and the baby with the other hand to get a good latch, and it gets the baby off of your incision, which is great. But if that particular position is causing more soreness, you may need to alternate with cradle hold or cross cradle hold. They're all different ways to do it. You can look at books about this, also videos about this, or consult your lactation person about this. Now, during the brand new breastfeeding period, we are often asked, is it okay to use a pacifier? Yes and no. Pacifiers aren't evil. Some babies don't ever struggle with nipple confusion and can go easily from an artificial nipple to your own regular nipple. But some do get confused. So early on, we really recommend not doing any artificial nipples until lactation is well established. Now, there are many exceptions to this rule. If a baby is born preemie and they're in the neonatal intensive care unit and you're having to pump and supply that baby's milk, you, of course, just have to do whatever is best for that baby's needs at the time. Many moms have to return to work very soon after the baby's born, and they would have to pump and have to use a bottle. So we'll talk to you at the follow-up weight check visits about what you may need to do. Now, I need for you to remember too that your child's pediatrician, we want the baby to get all breast milk. We love when infants are exclusively breastfed if the mom is doing okay, if you're doing all right, and if the baby's doing okay and gaining adequate weight. Remember that early on, all newborns lose down from their birth weight, often as much as 10%, while we're waiting for that mature breast milk to kick in. Now, if it's your first baby, or the baby has extreme jaundice, or there's extreme weight loss, more than that initial 10% that we're okay with, then we're going to have to supplement the baby with something. Some moms have donor breast milk, and many hospitals have this now, and that's ideal. If not, it is perfectly acceptable to substitute with formula. Formula is not evil, it's just not as good as breast milk, but it's much better than a dehydrated or sick or jaundiced baby. And if you do need to do that temporarily, remember, this is only a bridge until your full supply of mature breast milk comes in. It's not permanent. So please don't worry if you do have to temporarily supplement. I would just encourage you to trust your pediatrician. We are watching those numbers. There's a reason we do this. And often we're working in conjunction with a lactation consultant who can help us recommend to you ways of supplementation that won't jeopardize or sabotage your breastfeeding relationship. We often will just use pumped breast milk in a syringe with maybe finger feeding, which is when the baby can suck on a parent's finger and you have a little syringe in their mouth and you just kind of squirt in some pumped breast milk so that they won't be dehydrated or so that they won't have excessive weight loss. So we will work with you on that. I don't want you to worry if you can't always exclusively contact feed to get good weight gain in the baby. Other things that I wanted to mention to you. Some books, such as Baby Wise, really recommend from the beginning being strict about the schedule. That's not the way breastfeeding works. Breastfeeding works on a supply and demand system. So when the baby has a growth spurt, it's going to either nurse more vigorously, nurse longer at a session, or nurse more frequently. The more frequently your breast tissue is emptied of milk, the more milk it will make, which is why some moms can feed twins and triplets because they're pumping like crazy, and that just really builds up their supply. So if your baby's hungry, you need to feed it. If it is rooting on its hand, if it is trying to suck its little fingers, if it's turning its head looking for milk, if it's screaming and inconsolable, it's quite possible that it's hungry. And you honestly want to try to get it latched on before it gets to the inconsolable part, because then it's harder to get the baby latched because they're just frantic. You may even have to let it latch onto your finger for just a minute to calm it down so you can get it latched onto the real thing and get some milk in that baby. Now, when you're trying to decide whether the baby's still getting colostrum or mature breast milk, you could pump for a minute or hand express for a minute. The colostrum's a yellow, clear looking fluid, sticky and kind of thick. The milk is milk. It is white. It's gradually less yellow each day. But the real way you'll know, you'll hear the baby gulping at the breast. You'll see milk dripping from its mouth when it pops off and seems satisfied at the end of the feeding. And you will notice the color of the stool transition. The initial stools are a thick, black, sticky, meconium, tarry sort of stool. And after that mature breast milk has worked all the way through, then the stools will gradually lighten in color down to brown, green, green-yellow, and eventually a bright yellow, watery, with seeds sitting on the top of the diaper stool. And that's perfect. They will squirt little yellow squirts of stool with every breastfeeding session, even twice a session sometimes. So extreme numbers of stools per day early on are wonderful. They're binding up bilirubin and getting rid of it out of their body, and it means they're getting lots of mature breast milk. So this is a good thing. So if you feel like you're nursing your baby every hour and a half to 2 hours, that's okay. I promise it will get better. Now, if you have a baby that's just really good natured, never cries, never demands the next feeding, just don't let it go longer than 3 hours during the day or longer than 4 hours overnight. And we're not quite so strict once the baby is past their birth weight. Our goal there is for the baby to get up to birth weight by the 2-week mark. I can tell you too, some moms choose to exclusively pump the whole time. That's a lot of work, but they choose to for various reasons, including they're gonna have to go back to work early, they're nervous about their supply, or they're nervous about how much the baby's getting at each feed, or they want someone else to feed the baby the bottles. That's perfectly fine if you choose to do that. We'll help you with that. You need to make sure your flange or your funnel size on your pump is the right size for your nipple. Our lactation consultant, we can help you with that. It's just harder, I think, to stay motivated. Our goal is for that baby to nurse all the way up through their 1-year-old birthday, longer if you desire, obviously, but sort of our finish line, our target goal is that 1-year birthday. And sometimes it's hard to stay motivated enough with just pumping to stick to that because it's a whole lot more rewarding and bonding and sweet, of course, when you have the real actual baby latched. Now, we are willing to work with you too on figuring out a combination of pumping and contact feeds, and that works for a lot of moms, even sometimes to help their nipples heal if they've had some nipple trauma early on. Let me make sure. The last thing I just want to say is just take care of yourself. Keep eating, keep drinking plenty of fluids. Try to sleep whenever you can. Keep taking your prenatal vitamins as long as you're nursing. Now, we talked a lot about the latch. When you feel like you have got a good latch, I used to find myself all awkwardly positioned thinking it's perfect right here, but then my back muscles were killing me. So once you have the good latch and you've got the baby in your arms anyway, pull back the baby with yourself to a comfortable position and consciously tell yourself to just let your back muscles relax, or you're going to be really sore in your back as well as everywhere else from after a delivery. So do take care of yourself. You can make a little nest on the couch, and at the end table beside of your couch have water bottles and snacks, because you've got to keep drinking, you've got to keep eating. Early on, showers are optional, but you've got to sleep and eat and drink and take your vitamins. Do not worry about cleaning your house. That's the other reason not to have a lot of company over. You shouldn't be worried about that. Just think of these first 2 weeks as sort of survival mode. It's a marathon. Don't stay awake when the baby's sleeping just to look at the baby, even though they're beautiful. You need to sleep so your body can be healed enough to make this high quality milk for your baby. I just applaud you for attempting breastfeeding, and I want you to give it your very best shot, and I'm confident you can do it. God designed our bodies to feed our babies. So we just are available to help if you need us. Good luck.